Hi there, Dr. Sadaf Qureshi here, and today we are going to talk about histology of dental pulp. If we look at the structure of tooth, we can appreciate enamel, dentine, pulp, cementum, periodontal ligament or PDL, alveolar bone proper, apical foramen, interradicular bone, and tooth socket. But as we are going to talk about this area that is called as pulp, so we are going to focus on this. Dental pulp or pulp is an ectomesenchymal connective tissue that supports the dentine. It occupies pulp cavity in the central part of teeth, and as it is present at the central part of teeth, it is sometimes also called as endodontium. That means inside the tooth. Pulp is surrounded by dentine on all sides except at the accessory pulp canal and apical foramen, through which it communicates with periodontal ligament. Now let's talk about the histology of dental pulp. To understand the histology of dental pulp, we need to take section of dental pulp and enlarge it. By enlarging it, we get this kind of structure. Here we can appreciate different layers or different zone in this area. The first layer we can see is odontoblastic layer. The second layer we see is cell-free zone, and third layer we see is cell-rich zone, and these three zones, odontoblastic layer, cell-free zone and cell-rich zone, are combined called as odontogenic zone because there is a process going on that is called as odontogenesis. And we can also appreciate another layer, another zone that is called as pulp core. So overall we can say that pulp histology can be divided into four zones or four layers: odontoblastic layer, cell-free zone, cell-rich zone, and then we have the innermost portion of the dental pulp that is called as pulp core. Now we will talk about them one by one, uh, about every layer and zone. First we will talk about odontoblastic layer. To understand the odontoblastic layer, we will further enlarge this image, and can see there the upper layer that is toward the dentine is called as odontoblastic layer. It is found at the periphery of the pulp. It consists of cell bodies of odontoblasts, and that's the reason it is called as odontoblastic layer. It is lies continuous row in the dentinal end of the pulp. It may appear pseudostratified due to crowding, and it is the second most common cell in the dental pulp. The first most common cells are the fibroblasts. They are about 60,000 to 75,000 per square mm in number in coronal pulp, and to some extent lesser in radicular pulp. Talking about the shape of odontoblasts that are present in the odontoblastic layer of dental pulp. In coronal pulp, if we see the shape of odontoblast will be columnar. In mid portion of root, if we will see the shape of odontoblast will be cuboidal, but in apical part that will be spindle shape. And this change is due to because of functional activity that is different at different region, or that's the reason the shape of the cell is differs from one region to another region, even though all the cells are odontoblastic cell. If we see at the coronal pulp, the cells are columnar. If we see at the mid portion of root, the cells are cuboidal in shape, but if we see at the apical portion of root, we will see that cells are spindle shaped. Further talking about the odontoblast cell, odontoblast cell has two parts. One is odontoblastic process that is present in dentinal tubule, and the other is odontoblastic cell body that is 5 to 10 micron width and 50 micron length, and is present at odontoblastic layer of dental pulp, just adjacent to the dentine. If we look at the inside of the cell, we can see that nucleus is spherical and located at the base or towards the pulp, and adjacent to nucleus are most of the cell organelles. But apical part is devoid of organelles. It is because during dentinogenesis it is filled with secretory granules. Talking further about odontoblastic layer, there are nerve fibers that enter this zone and terminate between the odontoblasts. Odontoblastic layer and a subodontoblastic nerve network combine to form a sensory complex that contributes to dentinal sensitivity. Talking further, in odontoblastic layer, there are many odontoblast cells, and they are joined with each other by desmosome that provide mechanical union to cell. Another type of attachment between these cells are tight junction that form permeability barrier between the pulp and dentinal tubule. Another type of junction between these cells are gap junction that help in communication between adjacent odontoblasts. So In the odontoblastic layer of dental pulp, between the cell there are three types of junction or connections that are desmosomes, tight junction, and gap junctions. Talking further about the next layer, that is cell-free zone. In cell-free zone, we are going to enlarge this image and focus on the mid area where there is a relatively zero to minimum to zero cells. We can see there. This layer is present beneath the odontoblastic zone. It is approximately 40 micron width, and it is relatively devoid of cells. It is also called a zone of veil or subodontoblastic layer because it is present below the odontoblastic layer, so that's the reason it is also called a subodontoblastic layer. This zone is more prominent in coronal pulp and less prominent in radicular pulp. The major components of this zone are ground substance, and this zone diminishes in size or temporarily disappear when the dentine formation occurs at rapid rate. This contains network of nerve fiber that have lost their myelin sheath and are known as subodontoblastic plexus or plexus of ratio. Now we will talk about the third zone of dental pulp, that is called as cell-rich zone. To evaluate this layer, we will enlarge this image again, and we can see the area that has many cells present, and this is called as cell-rich zone. It is located just below the cell-free zone. It is narrow zone with increased density of cell and rich capillary network. It is a cell-rich zone is present both in coronal pulp and radicular pulp, and it is more prominent in coronal pulp, as it serves as a reservoir for replacing the destroyed odontoblast. Talking further about cell-rich zone, it consists of fibroblasts, undifferentiated mesenchymal cells, macrophages and immunocompetent cells, and young collagen fibers. Fibroblasts are most abundant cells and may be spindle or star-shaped and produce extracellular matrix. Undifferentiated mesenchymal cells are larger than fibroblasts. The shape may be spindle or polyhedral, and they may differentiate into odontoblasts, fibroblasts, and macrophages depending on the requirement. Talking about macrophages and immunocompetent cells, they may include macrophages, neutrophils, and lymphocytes, etc. So talking about the next zone or the last zone of dental pulp, that is pulp core. For this we will again enlarge this image or enlarge this histological section, and below cell-rich zone we can see an area that is called as pulp core. It is located in the center of the coronal and radicular pulp and referred as pulp core. It is a core of loose connective tissue with abundant cellular element that also contain large nerves and blood vessels that branch out towards the peripheral pulp area. In young pulp, pulp core contains more cells, but in old pulp, pulp core contains less cells. So this was all about histology of dental pulp. Hopefully you liked the video. If you like, don't forget to like, share, subscribe and comment. Thank you for watching.